Namaste. So when you are undergoing IVF, most commonly seen challenge these days is either there is no embryo formation or there is a weak embryo formation. So during the process of IVF, the embryos which develop with low quality eggs, they frequently fail to develop completely. So mostly on the third day in the process of IVF, if the embryo has not achieved a specific shape, or if the embryo has not achieved a specific cell stage, that particular embryo is not considered viable for further transfer or is considered weak, and hence that particular procedure is paused, is ceased, and then you are advised to again go through that drill of medications and hormonal injections and all, and then again you are advised to go further with the same procedure. But this does not guarantee or cannot assure that the same thing will not happen again. Again the weak embryo formation may be seen, or again there will be no embryo formation at all. So let's understand what can be done in such situations. So Ayurveda recommends Beejshuddhi. Bija means seed. So when it comes to conception, the beej, the seed basically is a sperm and ovum, Purush beej in men and Stri beej in women respectively. And that seed, that Purush beej and Stri beej, have to be of utmost good quality, devoid of any abnormalities. And abnormalities, it does not only mean at the structural level, it means at the genetic level, at the DNA level as well. So if these are devoid of any abnormalities or any defects, then eventually further embryo formation will be successful and the implantation process will be successful. So Beejshuddhi, so we have to make sure that these bija, the seed, the sperm and ovum, is at its utmost, at the purest state, devoid of any defects, and eventually it can yield results. So I give this a very good simple example to most of my patients, that when you are planning to plant a tree, so you want to plant a mango tree, you will always go and get the best quality seed. Log Vidyapit jayenge, Rahuri jayenge, they will make sure that they are getting the best quality seed or the best quality sapling, jo kalam वगैरह किया हुआ sapling होता है वो लेके आएंगे, then they will plant it because they want that mango tree to grow properly and yield the best quality mangoes, the tastiest mangoes. But unfortunately when it comes to conception, it's mostly unplanned, it's mostly unaccidental, and hence very less importance is given to all these things. But when it comes to Beejshuddhi, it means that the bija is taken care of, and with a series of panchakarma. So Beejshuddhi includes basic panchakarmas recommended by Ayurveda. It could be Vaman, Virechan, Basti, Uttar Basti, but it is recommended for both the partners, because just now as I mentioned, it's not just the role of the women, or just not the role of the ovum or the egg for the further embryo development. It's the role, is equal role and most important role of the male parameter as well, the sperm as well, when it comes with a healthy embryo formation, or the quality or a viable embryo formation, we can say. So always remember, it's the role of a men and women when it comes with embryo formation, I mean the sperm and the ovum. So Ayurveda recommends a set of panchakarma. These panchakarmas vary person to person as per the individual constitution and body type. So these panchakarmas are recommended. Along with that, a dietary regime, a lifestyle regime is planned, and overall corrections are recommended. A mindful positive correction, we can say, and de-addiction is also recommended for both the partners. So this helps with Beejshuddhi. This helps with the correction of sperm and ovum, or any kind of defects if there is at the bija level, and eventually when the fertilization process happens, the embryo is formed, is a healthy embryo, and the implantation can happen properly, or there's a successful implantation further. But it's not only till the embryo formation. Always remember, when you are planning for conception, our vision is not only till the embryo formation, but the embryo implantation should be successful, and further the fetal growth during the pregnancy process should be proper. The child born further should be devoid of any abnormalities, any kind of genetic disabilities, and the child should be having the best immune system. So if you are really thinking about the fruit, about the child born later, you should always start from Beejshuddhi, and Beejshuddhi has excellent results when it comes with infertility. But during the IVF process these days, the major challenge faced by most of the couples is there is no embryo formation. Beejshuddhi works wonderfully in such cases.